I'm Dr. Leslie McElrath, and this is stuff no one teaches you, Doctor Edition. So, we're going to start off with the most boring topic, which is health insurance. But you have to understand health insurance in order to know who you should be mad at, what you should pick, all of those things, right? So, first, we're going to start off with the different types of health insurance, and there are really only three. There's private insurance, which is offered either by your job or you purchase from the marketplace. You pay a portion of the fees with that insurance. This is the most common one for people that have regular jobs that are making a decent amount of money. Then there's Medicaid, which is a state sponsored insurance plan that's based on your income. So remember back during COVID when there was an expansion of Medicaid, and so more people got qualified for it, and now they're talking about rolling that back. So they're going to be kicking a whole bunch of people off of their Medicaid. You pay nothing with Medicaid, everything is covered by the state. And these are all run by for profit companies. So United Healthcare, right? They have a Medicaid plan. And then Medicare, you actually paid for that while you were working. So while you're working now, a portion of your taxes is going into paying for Medicare. And that's why there's a lot of controversy about what's happening in the economy and if Medicare is going to be available to us millennials, the Gen Xers, because the baby boomers are using a lot of it, right? You may have to pay a portion of fees with Medicare. So now we have to talk about some terminology, because if you don't understand the terminology, you don't actually understand what you're accepting. So the premium is the amount that you pay just to have that little card that says I'm part of MedMutual or I have Blue Cross Blue Shield. That's literally all that pays for. That can be as low as $500 a month, as high as a couple of $1,000s a month, depending on if you're paying for just yourself or if you have family members that are on your insurance plan. The premium is just to have that little card, right? But the deductible, that's the amount that you have to pay before your insurance actually covers anything, right? So I used to see premiums as low as $500, but that was with a high premium. So you would have a low deductible with a high premium. So the inverse happens. If you have a low premium, you tend to have a higher deductible. So deductibles, I've seen them as high as, for a single individual, $5,000. So you have to pay $5,000 of your own money out of your pocket before your insurance ever covers anything, right? So you have to understand that. Your premium just covers you having the card. The deductible is what you pay before your insurance actually truly kicks in. And then you have your copay and your coinsurance. That's your portion of what your insurance will cover. So even once your insurance kicks in, once you've met your deductible, you still have to pay your copay, your coinsurance. So that's that $30 or $25 that you pay when you go see your primary care doctor. That's your copay. And that's why about a month or two later, you get a bill in the mail saying, hey, you owe us some more money. That's because you have not met your deductible yet. So once you meet your deductible, the medical insurance covers that portion that you didn't have to pay as part of your copay or core insurance. And then your out-of-pocket maximum is when your insurance will cover everything, right? That can be, and that is higher than your deductible. It's usually another $1,000 or so before your insurance says, okay, you don't have to pay anything at all. We have everything covered. But remember the thing with insurance, every single year it rolls over and goes back to zero. All right. And so now we also have to understand the difference between an in-network and out-of-network provider, because that is very key. An in-network provider is someone that has signed a contract with your insurance provider to say, I will accept whatever you say, right? So even if I say that a physical exam with me costs $200, if I've signed a contract with your insurance company and they say, no, it costs $150 for my people, then I have to accept $150 because that's the contract that I signed. But an out-of-network provider can say, no, I said $200. The insurance says, well, I'm only giving you $150. That out-of-network provider can then charge you that's called balance billing. They're able to charge you that additional amount. Now, here's the crazy thing with a lot of insurances nowadays. The in-network and out-of-network deductible are separate. They used to be the same. Where as long as you paid your $5,000, whatever doctor you saw after that was covered. Nowadays, for a lot of people's insurance, and you have to look at this, there's an in-network deductible and an out-of-network deductible. So if you see a doctor that is not signed up with that insurance company, you are paying to a different deductible. And the crappy thing about it is, especially if you're going to the hospital, which I'm a primary care doctor, I try to keep people out of the hospital, but sometimes you need to go to the hospital. You can go to an in-network hospital that has out-of-network providers. And so you're still getting billed twice. They're still going to two different deductibles. It's insane. So why should you care about this? Understanding insurance, understanding what you're signing up for and what you're actually getting is key to making informed decisions when it comes to your healthcare spending, and how you take care of yourself. So we're going to go to another video. Hopefully it's right down below. And talk about our next topic, which will be the difference between health insurance and health care. See you soon.